How are you? Must be pretty tired at the end of a long day of very intense, high-level science. What I would like to do is to try to share with you some of my views about how to help patients going through the journey with cancer. I've been at UCLA 48 years, and so this represents some of my thinking about healthcare and how we need to kind of go back to the person. And because it's kind of very important that a lot of patients who are going through treatment with cancer are having a lot of symptoms, and that and many of the survivors also have a lot of unmet needs as well. So that's the reason why I think it's kind of very important for us as physicians or as patients to know what would be useful things that one can do, what would be some of the things that we should avoid, and most importantly, how it's important to let the doctors know about what you are doing, because obviously there's a lot of miscommunication, a lack of communication between the patient and also the various physicians caring for the patient. A lot of patients, particularly cancer patients, they are using it because when you're desperate, including physicians, they are going out of sort of the current biomedical approach. And that and we have been teaching at UCLA for 20 years now of at least what we have been doing in teaching integrative East-West medicine. And we're putting some of this into the curriculum, but again, it's not enough because obviously you have to break into a very crowded curriculum. So we have patients, conferences, we have been teaching first year, fourth year, and residents, and we have a 2-year fellowship. So we have trained a cadre of people, and we have 3 clinics at UCLA, but we're not able to service enough of the patients. Our next available appointment is March of next year. So, so what I would like to do is to actually try to have people be more aware of what is possible, what can be used to enhance the sort of the patient's lives, quality of life particularly, which may be translated to quantity of life. So this is the NILO style of NIH classification of the other approaches. Obviously, there's some interesting type of work on using electrotherapy for cancer as well, besides other other but obviously Tai Chi, Qigong, yoga, mindfulness meditation, diet, the use of herbal medicine. Obviously, the Nobel Prize last year was given to Toyoyo, who discovered artemisinin for malaria, which actually the drug has been used potentially for cancer and also for lupus as well, because it's immunomodulating. And obviously, a lot of people would probably enjoy massage, and massage has been very useful for a lot of people, for not just for relaxation, but I would talk about how many of these approaches may be very important to help with inflammation, which is really involved in 80% of the chronic diseases, because most of us have been focusing on a disease, but patients come to us in our clinic with 5, 10, 15 diseases and umpteen amount of drugs. So we have to figure out a way to treat the whole patient. Okay. So I will focus on Chinese medicine, and when I first came to UCLA, my idea about integrative medicine is to find a new drug, like Toyoyo will get a Nobel Prize, but I was exposed to the idea that China's embarked. So I have sort of, as a young medical student at UCLA, I kind of used UCLA as a platform to try to understand how the West approach health and disease, and at the same time try to understand how Chinese medicine over centuries and millennia approach health and disease. So what I have done is to say I want to build a new health model. So what I've done is the first 22 years at UCLA is to integrate Western medicines through internal medicine, clinical pharmacology, geriatrics, and bench clinical and outcomes research. but the last 22 years is to use the clinic as a clinical laboratory to test how this model that I think we have created to try to enhance the lives of patients who come to us referred by more than 500 physicians within UCLA. So then I can only talk about Chinese medicine because this is really the only medicine that I think I know something about besides Western medicine. Actually, I'd like to have some water if we can. So I'm very interested in all the talks that has been, actually I came in the afternoon, but I was really very intrigued by many of the talks in the afternoon. I'm sure I missed a lot from the morning, but I'm very intrigued by the prevention of cancer because I think cancer is a process, which I'll talk about. For sure, many of these approaches can improve the quality of life of patients. It'd be very useful for symptom control, for sure nausea, vomiting, for fatigue, and also to improve ability for people to tolerate conventional therapy. We help patients before the surgery, after the surgery, and before their during the chemotherapy, and also with acupuncture. And hopefully, by decreasing the stress, because it's not just like asbestos exposure. You think about other factors that increase the inflammation, including the stress, including sort of the diet, and many of these other factors. So maintenance remission is what some of the people who come to us, and some of the patients come to us as a last resort. So we also see patients during stage 4, for palliative care. Just a few words about Chinese medical model. There's never separation of the body and the mind, and that and it's very important to restore the balance and the flow. So balance and flow. So doesn't matter with cancer. Any disease processes, it's a constant battle between the noxious stimuli, which include asbestos, but many patients who are exposed to asbestos do not develop cancer, and a lot of patients develop mesothelioma has never been exposed to asbestos. So any factor, no matter how seemingly indirect, they increase the amount of noxious stimuli and decrease the endogenous resistance can accelerate any process. First, probably what we have seen is sort of the autonomic, the neuroendocrine processes, and then later on, the immune dysregulation, and ultimately the cancerous processes. So the cancerous process is a systemic disease. Local growth is only a manifestation of a larger problem. And that's why we really like to understand the patients that seem to sort of develop the cancer versus the people who have not. Besides the biological data, I'd like to know the person-centered data. So we wrote a paper about 10 years ago how we approach caring for patients with cancer. And basically, the main point is that how do you restore the balance? Because we talk about sort of balance between the various physiological processes, and oftentimes, by restoring the autonomic, system, it would lead to the, better control the immune system, and you have to individualize, okay? And so these are some of the modalities that we have used in our approach. Acupuncture in various variants. If you look at Michael Phelps, he get cupping. Cupping is a form of myofascial release, but it's also a local sort of acupuncture point stimulation. But it's kind of interesting that it's not a bruise. It basically is a cupping marks. So it would be kind of interesting to kind of relate to someone who talk about the difference between necrosis and also apoptosis, because some of these, those marks do not go through the green phase, the wound, the usual after bruising. Massage, we use massage actually. Sometimes you can use massage by taking care of the myofascial trigger points, and you can take care of a lot of the aches and pains and fatigue, but also the constant stimulation of the sympathetic system on the various processes. Tai Chi Qigong obviously is very, very useful, not just to augment the immune system, demonstrated by Michael Irwin at the Cousins, Psychoneuroimmunology Center, but also very useful to improve strength and vitality, and that help patients actually have less falls. And obviously, it's very useful for many physiological. So it's the difference between specific local therapy versus systemic, the whole person therapy. And diet, obviously, a lot of diet. We try to actually look at the patient's constitution, their pattern, and then we recommend particular diet for the patient, so that it, in general, is anti-inflammatory diet, but you can also think about very specific diet according to the various symptoms. So, so acupuncture, to me, is basically a method of stimulating the body to heal self. All of you actually have done it. Use your hand. When you have a headache, you put your hand behind your neck, and you have done it this way. These are local points, okay? But the Chinese has mapped out other areas to stimulate the area. There's about thousands of papers on acupuncture, and that a lot of neuroscience, has been published. So it modulates the limbic system. So one thing to decrease inflammation is to decrease stress. Okay, it also has improved people's sleep, and that cytokine sympathetic stimulation associated with insomnia, and that obviously there's the endorphin hypothesis. There is the other neurotransmitters. Nitric oxide has been involved, but it decreases inflammation. So because we actually see a lot of patients referred to us by rheumatology, and many of the autoimmune diseases we work with. So I really know very little about mesothelioma. I mean, I was very interested in asbestos and other sort of occupational lung diseases, because in the 70s I worked with asthma, and so I always think that it would be very important for us to decrease inflammation irregardless, because it's sort of and that's really one of the few papers that I try to review. I love to read many of the papers that many of you just published recently, but particularly Dr. Yang's papers. I really would like to see a little bit more about that particular protein and see whether it's. I don't think it's specific to mesothelioma. So anyway, and one thing that we always try to treat, and we use very little steroids. For asthma, we take people off steroids because your body. The reason why you need steroids is the body is not making enough steroids. By giving steroids, you downregulate the HPA axis and you make it worse in time. So my daughter-in-law is a pulmonary chief, at one of the Kaisers here, and I'm trying to introduce this work, to her, so that you can really take care of a lot of the asthma with very little need for asthma, because you can decrease the inflammatory reflex by using some of these approaches. Tracy wrote this very nice review back in, I don't know how many years ago now, in Nature, talking about the inflammatory cascade. And obviously he's using the affected vagal nerve, but you can do it with acupuncture-like stimulation. So just a few words about how acupuncture has been introduced in the field of oncology. There are now 25,000 articles related to acupuncture, and not that many, 1,300, just related to cancer. So what have we been using acupuncture for? Patients who have come to us with cancer, obviously pain, post-op nausea, vomiting, gastroparesis, GI refer a lot of patients to us, opiate-induced constipation, and pruritus, neuropathy. We usually try to do it, before and during, so that we minimize, the neuropathy. A lot of patients get like the fibromyalgia, like pain from aromatase inhibitor joint pain, and I think very importantly is to get people to have less stress and have better sleep, because I think sleep is very important. Eating right is very important. The Hematology Oncology Clinic of North America published a pretty nice review on just looking at acupuncture for post-op pain in cancer-related surgery. And we kind of look at the so-called chemo brain, because many patients get foggy, and that I think it's important that we use this potential approach. And we teach our patients. The key thing in our clinic is that since we cannot service all these patients referred to us by UCLA, we have to basically teach people how to take care of themselves. We ration our clinic, so visits, so that we teach them how to use a TENS unit. We teach them how to use their hands and golf ball and tennis ball to massage themselves. We teach them how to eat, how to sleep, how to exercise. So that's really our model when we use it for patients who come to us with breast cancer for the trial. So acupuncture is basically only part of a comprehensive approach that we have developed. It's a system of care that you need to focus on the whole person and using non-specific multi-targeted effects that work to re-regulate the system. Most people who, before they get the cancer, they are already very depleted and dysregulated. First is dysregulation of various systems, and then they get depleted from the treatment, from not feeling well, not eating, and so on. And so the goal is to try to figure out how to help patients to regain the ability to handle the stress, which normal daily activity driving in LA is stressful. And there's also many other stresses too, like at UCLA, right? That's fine. So I really don't have time to talk about herbal medicine. I think Chinese herbal medicine is going to be really very important in the coming decades. Toyoyo's Nobel Prize is only like the tip of the iceberg. She did this work like 30 years ago. I came to UCLA more or less to try to figure out how to use Chinese herbal medicine to improve the pharmacological approach. But obviously, we know that a lot of patients, particularly in the Greater China region, are using Chinese medicine, and an increasing number of patients are now going to be using it in the West as well. So it will be very important for us to, as physicians, to try to understand a little bit about what the patients are doing, because they're going to do it, and they may interact adversely with what we are doing. But if you learn enough, you may be able to try to be orchestrating it a little better. Professor Yongqi Chang, Tommy at Yale, he has moved his interest from developing antiviral and also anti-cancer drugs, to looking at herbal medicine. He's developing a preparation that used in Chinese herbal medicine for a long time as an adjunctive therapy for GI cancers, but basically he has demonstrated that not only would it not interfere, it actually may potentiate the response. But a lot of people are very concerned about the quality control of the various type of potential interactions. But in China, see, in this country, we only mainly use acupuncture, and we use like diet. But in China, they basically use chemotherapy, radiation, and also surgery with herbal medicine, for the last 30, 40 years. There's a lot for us to learn, from what they've been doing, and I suggest that they do a lot of surveillance, because it's only in China that you can do both at the same time, because we will never be in this country able to do something, about studying herbal medicine, because it took Professor Tommy Yang to get his trial to go through phase 3. It costs a lot of money to do any of these trials. So these are the evidence-based clinical practice guidelines for using integrative oncology, and that the society, there's a society for integrative oncology, and I think it was originated at Harvard, at the Dana-Farber. And they have a conference coming up, and it's interesting that for people who want to learn more about what to do, Dr. Fanobo at the National Research Center in Complementary Alternative Medicine at Norway, they have a website to put together a lot of the evidence for patients who want to look into what may be helpful or useful. Dr. Michael Irwin, I talk about his research on, psychoneuroimmunology and how to use Tai Chi to improve the immune system. And I also mentioned about, Professor Chang before. So I always have my patients to think about not just cancer, but anything that when you have an intervention, you want to look at whether you improve the quality of life or the quantity of life. That would be ideal, right? The quality of life includes how much money you have to spend, okay? And so it's very important for you to think about sort of the ideal would be effective, safe, affordable, accessible. Now, some of the things that we do, we think that, well, you do it, you have to suffer a little bit, but it would increase your quality of life. It may decrease your quality of life a little bit, okay? So the worst would be something that you do that would decrease the quality of life in addition to decrease the quality of life, okay? So I think it's very important for us to think, as patients, as physicians, as researchers, because it will be important to think about the balance. So let's see, how much time do I have? Still have a lot of time, right? So I'm pretty sure many of you who are researchers, you have to get your R1, your center grants, and the physicians who are under a lot of stress, patients, a lot of stress. So very important for you to kind of learn how to massage this point, which is very easy. Most of you are probably doing it without knowing, because I know that there are some patients here, but anyone, because I see so many people who are under so much stress, and I think that stress is really the central problem for many of us before, during, after cancer. So this is a point, and I would like you all to kind of massage that point. Now, except for those women who may be pregnant. If you are pregnant, this point may induce labor, okay? So we actually use it, during the last phase of the pregnancy to induce labor. But so let me ask you, how many of you think that you have no stress? No stress. Anyone? So you all have stress. So you all should really know something about this point, right? So why don't you just massage this point, which is really the highest point of that muscle, and you tell me whether it hurts you or not. If it hurts you, that means you're really under stress, okay? All right? And that actually in China, they use this for surgical analgesia. So they actually get people through surgery with a lot less medications. Before, back in the 70s, they actually in the 60s, they actually, the first case of tonsillectomy was done under acupuncture analgesia without the need for medications. But right now, they call it AAA, acupuncture assisted analgesia. So you use the least amount of drugs so that you can get out, of the operating room a lot quicker, or post-op, the recovery room. So this is a very, very useful point, because obviously at MGH, the human brain mapping, they demonstrated that when you do acupuncture on this point, it modulates the limbic system. So that's why many of the patients, when they come in, they put a needle there, they all would be getting distressed. And so that is, when you are stressed, then you get very tight muscles. How many of you have a tight neck? I guarantee you, many of you have a tight neck. And I'll tell you, your tight neck, one of the secrets of our work is to take care of that tight neck, right? That tight neck is not just a pain in the neck. Those people who have low pain threshold, they have pain in the neck and they have headache, they have migraine. If you do not, I have seen people with eye problems, ear, nose, and throat problems, jaw problems, TMJ. I've seen people with reflux. I've seen people with corkscrew esophagus. I've seen people with palpitations, patients with all kinds of problems. So because you have many of the regulatory systems, okay, in your neck, it connects the brain to the rest of the body, and the body sends signal up to the brain. So, and then obviously, the vagal nerve, as I said, modulates the inflammatory cascade. And if your neck is tight, a lot of things go on. I mean, a lot of patients, they have Hashimoto's, they remain untreated the right way because they just wait until the thyroid gets burned out. But in fact, later on, they come in with RA. I've seen them all, RA, IBD, and so on. So it's really important. So right now, I'm taking my work to primary care, not just physicians, but all the way down to maybe the person at home, most likely the woman at home, who will be the health coach and health navigator, because I know the next talk is going to be on navigation. So this is another point that is very useful. It's a point that is anything above the diaphragm. So since this is a mesothelioma, it's a conference, so anything above the diaphragm for people with cardiac issues, pulmonary issues. So a lot of research has been done on stimulating this point by Dr. John Longhurst at UC Irvine, who is a neuroscientist. And but we have actually used it to help patients with their arrhythmias, and for sure nausea and vomiting. For people who go on a cruise, you always get a wristband to help you with the seasickness. But because it also calms the mind, we use it also for people with insomnia as well. So, I'm sorry, let's see. So for those of you who would like to know a little bit more, I mean, I talk for different type of cancer conferences. I spoke at the pancreatic cancer, and I'm kind of very interested, with a cancer that actually have a very short lifespan after it's developed. I think it will be very, very useful to figure out how to do trials, to randomize them into this type of therapy and this type of therapy, and see what happens. Because I really would like to look at quality of life, I want to look at economic cost, and also look at safety. It would be a very interesting study that would be interesting. So Bill Goh, who runs with Howard Reba, who runs the Pancreatic Cancer Center at UCLA, he's been trying to discuss with me about how to put something together. But right now, I was involved in a project in Shanghai that I kind of proposed 6 years ago. But in Shanghai, we helped train 12,000 Western-trained physicians and public health workers within the entire community of Shanghai, 24 million people, 18 regional hospitals and 240 clinics to learn Chinese medicine over 6 months. But that's kind of exposure. So I like to answer questions. I know that this is not the usual type of talk you would get, but I hope that it gives you some food for thought. Thank you very much.